I'm just going to introduce myself. My name is Deb Overly. I'm the Franchise Operations Director for ActivAge. Kris is going to join us. Kris Channel, the founder of ActivAge, will join us shortly, and he's going to answer. We're going to do all kinds of Q&A. He's just going to answer our questions. While we're getting everybody in here, I'd just like to chat with everyone, take a breath, relax from your Wednesday, and think about your top 2 questions that you might have, and go ahead and start loading them into the chat box so that when Kris gets on, we can start with the Q&A right away. Everybody on here, I see some people that are regulars, and then there's some new ones. So for the new ones, we'll do 45 minutes of Q&A. Everybody on here is in a different place in their journey with adult daycare. Some are just learning about adult daycare. Some are debating whether to do franchising or go on their own. Some are trying to get through licensing. Others have opened and are trying to drive business. And we have members from all different states. So we really do learn a lot from each other on these monthly webinars, and also through the Q&A. So like I said, go ahead and start loading your top 2 questions in there on the chat so that when Kris comes and joins us, we can get off and running with those. He'll try to spend about 5 minutes answering each question, and then he'll go back around and take some other questions from you if we have time. Okay. Nicole, what state are you from? Can you hear me?
I can hear you. I was just trying to
now I can
stuff off mute. I'm actually in Florida, not far from you guys, in Lake County, Florida.
Oh, okay. And where are you on your journey with this?
So we've been open for 2 months, well, almost 3. So that's where we are. So we're really trying to increase capacity. So we currently have 4 participants, and 1 in the process. So
okay. And
marketing.
How many do you have room for? What would your max be?
Well, we want, because we target mostly dementia. Our daily capacity is 12. We do, according to ACA, I mean, we could have more, but because we don't want a high stimulus environment,
right.
12.
Right. Yeah, it can get agitating if there's too many in too small of a space.
Correct.
Yeah. Okay, so load up any questions that you have over there, and let's see who else is on here. Brian, what state are you in?
I'm in Montgomery, Alabama.
Okay, and where are you on your journey here?
I'm new. I was working on a residential system living. I just want to get this information here, so I'm new.
Okay. Okay. All right, you'll learn a whole bunch of stuff tonight.
Awesome.
Because everybody here is at a different place, and there's other ones that are new, and just some people are just finding out, like looking into it, finding out about it, all kinds of things. So yeah, it'll be good. Bill, are you with us? Yeah, can you hear me?
Yep, hello, I can hear you.
Hi. What state are you in?
I'm just north of Chicago, and I've just been getting to know senior living as a technology provider. So just looking to learn about the adult day side of things. We work with some hospitals, some senior living and individual care partners at home, providing support.
Oh, that's cool. Okay. Yeah, because an adult day is relatively new compared to assisted living, and all of those things. And sometimes the technology can be pretty challenging, actually. I know with ActivAge, we've had to do some proprietary software ourselves because there just is nothing out there, that really will fulfill the needs that we had.
Sure. Yeah, we've got an app called Zinnia, Zinnia, and we
Mhm.
provide video care tools that help care partners to reduce negative behaviors, facilitate activities of daily living, and just generally engage and connect.
Right. Okay, cool. All right, let's see
Thank
who
you.
else is on here. Erica, are you there? There she is.
Yes,
You
I'm
don't have to show,
here.
you don't have to show me a picture, but where are you from?
Oh, I am from Georgia. So I
Okay.
mhm. So I am in the process of trying to or getting started in adult daycare. I actually went through planning and zoning last year, but because the space that I was renting was so outdated, hadn't been occupied for a while, some zoning things had changed. So it's been a year before I can even get into the building, just trying to bring
Girl,
the code.
oh
Crazy.
my
It's
God.
not even a big space. It's a small space,
Yeah,
2,600 square feet. So
okay.
but in Georgia, just trying to get it going.
Yeah, all right. Well, put your questions in the chat box. I know we have a lot of people that are just trying to get it going, and it's been, and for others, I don't see Mary on here yet, but for others, I mean, it's been a long journey. Hopefully, with some of the information you get from the webinars, and also we have a Facebook group, ADC Pro, which is I recommend all of you join, because questions in between webinars, a lot of people, they'll bounce them off each other, and we can help each other that way. But it can help shorten your journey a little bit. So hopefully you'll get some good stuff out of tonight.
Yeah, and adult daycare is so new. There was actually a guy he's a Kroger marketer, and he saw my signs in my space that said Lily's adult daycare coming soon, and he reached out to me, and he was saying in Florida they're everywhere, but in my area we only have I maybe have two other competitors in my
Right.
area, so it's really new.
Yeah, it's new, and even in Florida, but really nationwide. That is the challenge, is to get the word out about adult daycare, that it exists, what it is, how it can help the caretakers, and the members stay at home, and still be able to, everybody still have a life, you know without the caretakers getting totally burned out, and with the members having a safe place to go and have fun during the day, and a purpose back into their lives. So, I mean, we find with a lot of ours, they come to us, after about 2 years of sitting in the recliner watching TV, and
Yes.
they just don't even want to get up anymore, because they just have lost their reason, you know and we've had members even that wouldn't get up, wouldn't get dressed, stopped eating, and once they were put into, came into our program, it just, the socialization, the feeling of belonging, the physical stimulation, the mental stimulation, and we have a man that he gets up, he gets dressed, he's sitting on the side of the bed, and he's asking when it's time to leave every morning now, because he has a reason again, to keep going and to live and to have some fun, and he has friends now, and there's Kris.
You're doing you're doing so good, Dad.
Hey, do we have some? I can't see the chat box, Kris, right now. Do we
Yeah,
have questions in there? Okay, cool.
there are some.
All
There are
right.
some.
I
And
tried to get some teed up for you there.
I'll say
Okay.
Thank you, Deb, for kind of getting everything started. I hope you guys are all doing well. Really, like, our goal as this webinar has evolved, our goal really for the first like 10 to 15 minutes going forward is going to be hopefully trying to like build build some relationships with you guys. Hopefully you guys can build relationships with each other, and we can kind of create a stronger bond, because we'll know like where everyone's at and what everyone's going through, and then you guys can lean on each other too, like, outside of these webinars, to support one another in your journey and that and stuff like that. So so hopefully you found this this initial time helpful, and hopefully I can make the rest of your time here too beneficial as well. So thank you very much, Deb. And for everyone on this call, feel free to put it in the chat. If you'd like, feel free to raise your hand. There's a little icon you can press to put the little hand emoji up on the Zoom call as well. So however you want to ask your questions is great. I can certainly go to someone in the chat box first if you'd like. It looks like Erica Thomas. I see you have a question here. If you want to come on and maybe share in a little bit more depth, I'd be happy to jump in there with you.
Yeah. Hey, Kris, how are you?
Good. How are you?
I'm good. So I was just saying, I actually spoke to you last year during one of the webinars. One of your friends came on.
I knew that name looked familiar.
Yeah, I had watched one of your videos. One of the guys, one of your friends, he started a business. I think it was in New York. I'm not sure, but he started with like a 2,500 square foot building when he first started, and he outgrew it. And
yeah, Yanni, he's in South Florida. Yeah.
So I leased a space, and because of some zoning issues that had to be brought up to code, I'm just now starting to do some renovations. It is a smaller space, about 2,500 square feet, just to start. So in Georgia, we're regulated by the state, and it's very strict. So just going through all of the zoning process, getting my policies and procedures together. But I'm just trying to think of, hopefully in the next 3 months, everything will be complete. But what can I do to go ahead and start marketing so that I don't, because I know one of your videos, you said at least 3 to 6 months, go ahead and start marketing.
Yeah, for sure. Like
to market that I'm not licensed yet.
Yeah, so that's the hardest part, right? Because like you can't technically spend a ton of money on advertising that you have these services, at this point in time, because you don't have a license yet, So it's like really the number one thing you can be doing right now is building relationships with the right referral partners. And there's nothing that's preventing you from being able to go to these individuals and starting to build a genuine relationship with the case manager at that skilled nursing facility or that hospital, or with the placement agencies in town, with the community of senior care or healthcare professionals that are going to be those like right referral partners for you. There's nothing preventing you from at least developing those things, taking someone out for coffee, collecting cards. Like the best thing you can do right now is build relationships and then build an email database that you can use to share all of your updates as you're going through this process. So for me, when I first went into a town, I know when we first started in business, I had never been in the town that we're in today. And the first thing I did is I went to both chambers, picked up a directory, took every single email address in that directory, put them into an email system. And now I at least had someone to like communicate to. And then I went out and I started building relationships with, I found a list in Florida. There's a website you can go to that has a list of all the licensed assisted living facilities, all the licensed skilled nursing facilities, Medicare home health agencies, home care agencies, and so we were able to pull off that list. And I went and met every single owner or marketing director of each of those things and built the relationships with those folks, so that by the time I opened, everyone in town knew who I was, and they all knew when I was opening, and they all came to our grand opening, and they had all been a part of the journey, and they had embraced that entire process.
Thank you. And my next question was, so I do have a home care agency. What tip or advice would you give to someone who has, you know, I got both. It'll be two businesses, and I have systems set in place, but just so that I'm not, because I know I'm gonna have to spend more of my time in the adult daycare once it started. So, what tips would you give to sort of manage both of them?
Yeah. So one of the things that you have to do is you got to find somebody, you know, that can be your point person. So like this is going to come in two different like, you know, stages potentially. Like there's going to be a period of time where you may have to rely on a caregiver that has leadership abilities that you might, you know, that maybe has never like truly led a home care organization, but this one person that you know in the organization that knows everything like almost as well as you do, like they're just aware of almost everything that you're aware of. You know, could that person become someone that you could appoint as like primarily responsible for home care, and you could lead the home care organization through them while you go focus on the daycare? There's no way that you could be fully in charge of both, so you're going to have to delegate the leadership responsibility to someone, you know, and you know, if you can afford to hire someone, you know, just for that role, great. If you need to bring up a caregiver and maybe bring that person into more of a leadership role, so they still kind of share a dual responsibility of being the leader for home care, but also being like, you know, part of the care team, then you do that, you know. But it kind of depends on where you're at financially. But you're gonna have to like, you know, you're gonna have to like somehow appoint someone to be primarily responsible for the day-to-day operations of home care, like in order for you to focus fully on it on the adult day. Like,
Thank you.
and to give you a practical example of that, like, you know, Deb is my primary, like her primary focus right now is we've been shifting her away from our one Port Charlotte location, and she's being shifted now to like franchise operations. And so like, you know, we've been like, so eventually in the next 2 months she'll be full franchise, you know, and won't be have any, you know, any responsibility or any like oversight of the day-to-day of our Port Charlotte location. And so we have an admin that runs our Port Charlotte location. We have an admin for our home care agency. We'll have an admin for our Sarasota location. So every single person, like there's one person that's like directly responsible for the day-to-day operations of that business line.
Okay, thank you.
All right. I'm gonna go on to the next one, but Erica, good to see you. And thanks for coming back and joining us on our webinar. Unless someone like shouts out, I think Tammy is interested in obtaining guidance on how to get this done without being over. Okay.
Hi, Kris.
How are you, Tammy? I don't think I've ever started a business and not been overwhelmed.
I know. Let me tell you, just going through the websites, trying to, you know, maneuver the state licensing, how do you, you know, start, how do you get the name out there? But you actually gave some very good advice, even on marketing before we get started. Our situation is maybe a little different. We're looking to open up an adult daycare center in Mississippi. We do have a building already, but you know, of course, I need to make sure it's up to code. I need to check with licensing. So I was on the websites looking. I just need like a cheat sheet, a checklist. Where do I start to make sure that don't jump in the middle without having touch base with some things or with some people before I get to a step? But I did also hear one of your other videos as I was Googling, and I noticed that you went right to the point. You got straight to the point with someone, and you said, hey, you're in this state, this is where you start with these people, make this phone call, go to the website, download this. I said, well, I'm going to just log in and sign up and see if he can give me that.
I'm trying to think. So I think that those other two states, I knew they had a strong association presence. I don't know off the top of my head if Mississippi do you know, maybe through your research, if Mississippi has a state association? Like, so like for like some states have them, some states don't. Some states are kind of like, they're like hodgepodge, you know, like they're barely there's barely an association, you know.
They do have a regional presence.
Okay.
You know, the state is divided like into regions, and you have your your region that's your, I guess, go-to or for trainings, development, something like that. But to even start, I had to start with the Secretary of State.
Gotcha. Well, and there's going to be like a licensing component. Okay, oh, here you go. I found it. Okay, so it's missaAADS.org. So missaAADS.org.
DS. Okay. .org.
Yep. So that is your okay. It looks like, okay, sorry, I'm just looking at the website, so I apologize for any confusion. It looks like they have their own conference, which is good. Looks like they have a 2023 conference coming up. Let's see, did it already pass though? It may have already passed.
I think it did, because I looked at it.
Yeah, it was in March. Okay, it was in March. But they have a phone number on here, and it looks like they're active. So I would reach out to them first. They're going to be able to like guide you, and like because I can certainly help you in certain aspects of adult day, but they're going to be able to like at least help you when it comes to like state regulations and like hey,
and
talk to this person.
and
Yeah, because there's a lot of the licensing components that are so different per state that I would rather you go to the association, allow them to connect you with someone within the association that you could go like pour into a little bit as far as like how things work. And then typically like, my biggest thing I see too many times is like, it's important for you to pick a vision for your adult day center. So like, I don't know if you have a size in mind, a budget in mind. I know you have a building. I don't know if you own the building or if you, are leasing the building, or if it's a building that, but like a lot of times, like, it's like vision first of like what you want to create, and then we'll back into it with budget and, building and all that kind of stuff,
Okay, that's good.
So
thanks
like
again for the marketing tip.
Yeah, and so so is the building you have, is it leased already, or is it something you own?
Actually, it's owned, yes.
Okay. Because are you are you converting like a building that you already have into like into another?
Right.
And how many square feet is that?
That's a good question, and I was hoping you wouldn't ask when I heard the other young lady talking, because I don't know right now.
Okay, gotcha. So the thing is to like, just something to take into consideration would be like, obviously get in touch with the Mississippi Adult Day Services Association, and then let's like identify the size of the building, as far as like the square footage that you have, so we can kind of get to a like, okay, how many people per day can we expect in this space, and then we got to start picking out, okay, is that like building zoned appropriately for that? Is there any regulations, for licensing where they might have like, you're allowed one person for every 45 square feet, or one person for every 65 square feet. Like they might have their own thing. And then you go over here to like zoning, and then like, am I approved for an adult day center in this space? And they're like, check. So state licensing, I can have 60 people. Like zoning department says I'm approved for adult day. Now it's like health department and fire sprinklers say, okay, you can't have 60, you can have 50. Okay, so then I have to have 50, so it's like, there's all those little like components that make that up, where, what might change is like, the number of bathrooms that you need to have in that space, depending on how the building is zoned and classified, may affect like the amount of usable space for your attendance, but I would start with like some of that, so you can at least have a great, you at least know, okay, building's good, check. I understand my licensing, check. I understand how many people per day I can serve, check. And then now it would start to be like, okay, so what would it look like for me to, ramp up to capacity, and like, how much money am I going to need? How much money am I going to need for construction? Do I need to get an SBA loan? And then there's those kind of other steps, but.
Okay, I will start on that tomorrow. I see Deborah put something in the chat. Deborah, what is that? mdhs.mississippi.gov?
Yeah, that might be the rules and regs, I'm thinking. Yeah.
I'm sorry, I couldn't get to my mute, but yeah, that's the rules and regs for Mississippi.
Wonderful. And I did read that. It was a little comprehensive. I'll go through that tomorrow as well. I had to download it. Okay.
Yeah, so
Okay,
but that's
yep.
why I love, like, if there's a decent state association, that's the best thing you can do, is just get plugged in with them. Most state associations are going to be small enough that when you do get plugged into them, there's gonna be a handful of people. They're gonna be like, hey, talk to Mary, okay, and speak to
Yeah.
Jane and this person over there.
And this site also has all the different daycares on it. So maybe you can make a connection with one of the other ones in the state. Yeah.
Wonderful. Thank you.
No problem. And then when you get to the next step, then call and come back on. We'll help you with the next step.
Oh, I will. Thank you.
Okay. All right. Who else we got here? We got Tammy. All right, Suzette. Are you on, Suzette?
Yes, I'm here. I was trying to unmute myself. Hi.
Hi, how are you?
Good. Thank you. How are you, Kris?
I'm doing good. So I think, go ahead and ask those if they're the same two questions, but go ahead and share with everyone, and then I'll dive in there.
Yeah, I was asking if an adult daycare can offer the HHA services as well, or if that needs to be under a separate entity, a separate business. I'm guessing so, but I just want to make sure.
Yeah. So, and you're in Florida, right?
Miami.
Yeah, you're in Florida.
Yeah.
Miami. Yeah. So in Florida, like, in order to provide in-home care, like, you would have to be under, they made an exception during COVID. I think that ruling is expired now, so so that being said, you would have to have a home care agency license or a nurse registry license to be able to provide home health aides, CNAs into the home.
Okay, and do you know where, or is there something in the website that, on a website that we can read about that? How do I find out what's the process to have that done?
To go through the licensing for that?
Yeah, for the what was it? Home care agency?
Yeah, so for the home health agency, yeah, I mean, there's a ton of stuff, like there's a ton of companies out there that have like how-to videos in Florida, and stuff like that that could probably, like, I mean, there may be a few of us that talk about it all day, but on home care, there's a ton of information on YouTube for that.
But you do have that as well, right?
Yeah, we have a home care agency. Yeah, we do. It runs under a separate company, but it is it's a home health agency. It's going through the licensing process takes time. It's certainly it's a different beast.
Okay, yeah. So it's a totally different entity or business, completely
Yeah,
separate from adult daycare. Okay.
It is. Yep. And the hard part, sometimes is, like, if when you're first starting out, trying to juggle both can be really difficult, and then trying to market both can be hard too. Like, where it's
the reason I was asking is because we're trying to get new participants, and here in Miami, most of the participants are, mostly on Medicaid. We don't have that many private pay.
Yeah.
So they mostly have HHAs in their homes, and it's really hard to, get them out of their houses and stop those services. So we were trying to see if that was something that we might be able to offer as well, because they like to be at home sometimes and not just be on the adult daycare every day. So that's why we were trying to see if that was something that we could offer as well. But
you certainly can, through that other license for sure, and yeah, and obviously that one you wouldn't have to have a building, and you wouldn't have to go through construction, you wouldn't have a lot of other stuff that you would have to do, but there's still elements of that you still have that, like, proof of financial ability. You still have to have an inspection, there's still, like, that whole, like, process, and then you'd still have to apply for a Medicaid number too,
So it's a separate Medicaid number, NPI, all of that.
Yep.
Okay, I see. And then the other question I had, it was, that how the insurance, the providers, they offer to their patients this supermarkets cards with funds, so they can go and buy their groceries or medicines. Can adult daycares offer that as well? Do you know? Is that
Like you want to offer that out of your own pocket to pay for them for that, or?
Yes.
Gotcha. I mean, I don't know of any reason why you couldn't, help them
Okay.
out with that. I mean, I know there may not
Because
necessarily be a reimbursement.
we have a lot of them that they ask, what can you provide, the family members? Do you provide any type of help or assistance with food, with medicine? And we are like, well, we might find out if we can do that. So we were trying to see if that's something that we can do before, we just tell them, hey, yeah, we can give you this,
Gotcha. Now, are they referring to like additional help outside of the center, or are they referring to like
Yes,
help with medication?
yes, like money on a card or
Okay.
a gift card or a prepaid debit card. Like the medical insurance offer them, Aetna offers like every 3 months
Yeah.
funds in a card for they to buy food and all that stuff. So I don't know if that was something that we might be able to do that adult daycares can offer as well.
Yeah, I mean, maybe it could be a marketing, thing that you could use, to help maybe people choose you
Right.
over another place,
Right.
So, but yeah, there may not be any reimbursement for it to you, but you
No,
can
right,
certainly
I
do.
know.
Yeah. Like I know we offer like a referral rewards to our members. So if they refer someone to us, we offer them an account credit of like $250 on their account, so so that's one
And
way
you
to kind of look.
do that, to the participants, or?
Yeah, so like if a family, like if family or participant, most of our participants have a family caregiver involved or
Right.
someone that's a representative, and so we offer to those representatives, if they know of somebody and they start with us, we will provide a credit to their account. Now this might be one of those things where, like, I'm just giving you an example of how we do it for private pay, right? Like, so like someone comes
Okay.
on board, it's private pay, like we're going to bill them for the month, and then we might include a $250 credit if they had referred someone to us the previous month,
Right. But for those that do you have like Medicaid participants that you offer rewards to those, or no?
Yeah, we don't on our Medicaid folks. Only
Okay.
because it's not our focus, and then obviously the reimbursement is about half of like private pay, so
Right.
it's hard for us to offer that on those. And there also like can be sticky stuff around like the whole idea of like kickbacks or like referral fees, and stuff like that. But there's nothing to like that could hurt as far as like helping out some of your members that come to you, so.
Okay. Okay. All right. Thank you.
All right. Hey, no problem. All right. Who else we got here? I think Roger. Okay. Alicia in Georgia. See that? So email me. Okay. Who else is? Or Nicole? I see you got a hand up in the chat. What's up, Nicole? How are you?
Hi, Kris. How are you?
Good. Good. How's everything going in your world?
Everything's going. Actually, I was just on here just to gain information, and then you said something that made me think of a question. So you mentioned you mentioned that you have the home care and it's a separate entity and the difficulty with marketing. And that's exactly my dilemma at present. So I wish, hindsight, I wish I would have kind of made the names closer together so it was, or like kind of put them somewhat under the same umbrella but separate, because you only get like 15 seconds of somebody's time, and when you're trying to market both, like, just what is your advice? Because the home care came first. The home care was very successful at first, and not that it's not, it's just really stagnant right now, and probably a lot because so much time and effort went into getting the adult daycare running. So I really wasn't out there marketing and stuff. And then when people unfortunately passed away, then it's kind of like, now I'm stuck with like a core few. And so I'm trying to get the adult daycare off in at capacity. But the home care yeah, so I think
Yeah,
maybe you
no.
probably understand my dilemma since you
I to-
mentioned it.
Totally. Yeah. So I mean, first of all, if I could do everything all over again, I would pick one business and just do the one. You know what I mean? There was a time where we had assisted living, adult day, and home care, and marketing all three of those. Like you go into a case manager's office and you're like, which card do I pull out today?
Exactly.
It's like,
Exactly.
and so like, and that can be, can be difficult because sometimes like, when you're like every one of them is being affected differently. I mean, they had its pros and cons, right? Our adult day center typically was a great referral source for our assisted living facility. Sometimes our adult daycare and our home care work very well together. But I would say like if there's a way for you to bring the brand so they're the same brand and you can bring it under the same name. To give you an example, like when we had our assisted living facility, I started in senior care with Chelsea Place, right? So like Chelsea Place was very specific, like that name, kind of lended to the idea of a place, of an assisted living facility. It made sense for that. And then we opened up the adult day center and it still kind of worked for that too, because it's still a place to go to, right? And then we added the home care agency and we like man, should we change? What should we do? But we decided to go just under Chelsea Place umbrella because it was just so much easier to just say one brand and then have marketing for one brand. So,
yes.
I would definitely encourage you to like think about, like, you wouldn't have to change the business name. Like, so for instance, like we are ActivAge now, right? Everything we have is ActivAge. Our company, our Medicaid number, our MPI number, all that stuff, it's still in the original business name. It's still Chelsea Place, whatever it is, LLC, right? But we have a DBA that's like ActivAge this, or DBA that's ActivAge that. So you can still keep both companies under the different name, different LLCs or whatever, and then maybe brand that one underneath your thing and start changing the marketing where on one piece of marketing, you can have both services. I think that'd be a great place to start, but then I think too, it's like going back to like, do you have one person, running home care? Or are you trying to manage both right now? Have you are you more in charge of one and you kind of have a helper person over here that's helping you out with the other? Like, I'm not quite sure how you're set up. Is there a point person that you have?
So honestly, I am everything. I am the operator of the adult daycare, and I am, the administrator of the home care. I do have, like you mentioned, like you were telling one of the other ladies on here, I do have a caregiver who actually used to have her own home care business. So she has that business mind, but she's at the point where she's older and she doesn't want to do it, but she really wants to see it successful. So ultimately what I'm doing is transitioning her in to be, because she's one of the what do they call it in the world, assistant operators or whatever, and so she will take over more of the day-to-day of the adult day. I will be there every day, but then half days I will go and just market the home care or be over the home care, if that makes sense.
Gotcha. Yeah, it's more so like I was just saying, like, whichever one of them needs your specific attention more, I would lean into that one, and then the other one that like has some systems up in place and is is running already, like then that one I would try to like figure out who can help me run that one.
Okay.
And the reason why that is like, because if you can get to a place where you have a strong operator, that admin person can kind of be the face for that company, and then you can kind of be the face for this other one that you're promoting, and then you can kind of tag team them that way, and it's like, when you introduce someone, this is so and so, who's with my home care agency or with my adult day center, and you can kind of start forging those different relationships, in the community. But I think the biggest thing is bringing it all under one name. And then it's like, okay, where do I go to strategically market home care? And then where do I go to strategically market adult day? And then some rooms I might just go market adult day because it's unique and not as many people are talking about it. And then other rooms I might, hit up a little bit harder with home care because they've sent me home care referrals in the past. And I want to remind them that we still have that, and so it's like, but like, it'll be easier for you to walk into a room and have no competition if you talk about adult day. But if you walk into a room and talk about home care, like you're one of 20,
Right. I get that.
So sometimes we use adult day as like our way in the door, and then we're like, oh, and we have home care too.
Right. One other question. Thank you. One other question.
Yep.
How does your guest pass that you have, do you recommend other owners do that? And
Oh,
how does that work out
absolutely.
for you?
Absolutely. I don't think we'd have any members if we didn't have it.
Wow. Okay.
Yeah.
That's a bold statement.
So it's so in the state of Florida, something that's important to know is it's really an extended tour.
Mm-hmm.
They are a guest. They're not a member, right? So we have a piece of paperwork that they sign that helps everyone understand that like they're not a member yet. You know,
Oh,
like
jeez.
you know, like so like they're not you know, like there's no formal paperwork, like no TV test, you know, they're just here for an
So if
extended
Aka
tour.
walked in, you can show that.
Yeah, exactly. Like they're admitting like I am a guest. I'm here for an extended tour. You know, I am not a member or a participant, you know. So it's like, you know, it's using like you know, we have the laws that are in place, you know, and you know, members have to, or I shouldn't say, in the case of Florida, participants have to have certain pieces of paperwork in order to attend. That stuff creates so much friction. And you know, what's crazy is you can have an assisted living facility, move somebody into your ALF, have no 1823 and
For 30
no
days.
TV test for
Yes.
30 days, and they can come and live 24/7.
Exactly.
But to
Right.
come into an adult day center, you got to have a TB test, a participant health assessment form. Like we just had a lady complain yesterday. She's like, she went to go get the TB test, and then her mom was upset because they, you know, put a needle in her arm, and then they had like that one didn't work, and then they did a blood a blood draw one, and then like, you know, like they didn't get enough sample size, and then she's just like, I'm just done. I don't want to do it anymore.
Yeah.
And so we're potentially going to lose that person because of all of the initial restrictions, you know. And it's like, it would have been different if in 30 days, like her mom loved it so much and she's like, look, I will do whatever it takes to get mom to go get her TV test, you know, like, because she knows mom loves it. Right now, like,
Mm-hmm.
you know, like, you know, so the thing that's important is like, how do you reduce the barriers to entry? How do you reduce friction? And honestly, we convert 80 to 90% of our guest passes, you know. So it's like, if we didn't have that guest pass, I have no idea what we like. I don't like, I would be scared to operate without a guest pass, you know.
That's great, Kris. Thank you so much.
You know, and now I will say this though too, we really go the extra mile on that guest pass. Like, we want to make sure that that guest has the best experience ever, you know, because we know that if we can at least like open their eyes or their minds to this environment where they can have fun and really enjoy themselves, that they're going to come back.
Right.
And so it's just a matter of like, really, like, if you can, you know, knock that first day out of the park, then the rest is history, you know, because like by the second, third, or fourth day, they're having a good time. They got a couple of friends, you know, like, you know, they're really enjoying the socialization, being out of the house. It wasn't as scary. It's not a nursing home, you know, like all those other preconceived misconceptions they may have had, they're gone now, you know.
Okay, my last question is quick, and I'm just gonna be bold and ask it. I'm so sorry. Would you consider someone like, well, would you consider me coming on a guest pass? So, because I know you guys do the activities right, and that's what I want to make sure that we're doing well too.
Would I recommend that you be there for your guest pass?
No, would you consider having me come visit ActivAge?
Gotcha. I mean, you know, like I can't stop you from visiting, you know, but you know, I know like you know, you know where we're located, so I mean,
Yes.
you know, you know, the team would be more than happy to show you around, you know, if you happen to be in the area, for sure, you know. I do have to be conscientious of, like, you know, our franchise, our prospective franchisees, you know, we do have a formal process for them. But if you happen to be driving the area and you want to stop by and say hi to the team, I mean, we're not gonna
Kick me out.
you know, yeah, we're not gonna kick you out, you know. So
Okay.
but
Okay.
you know, yeah. So
Sorry to put you on the spot, Kris.
No, you're good. We just don't want, like, you know, we don't want like 150 people showing up tomorrow. You know? So we don't want to overwhelm the system.
I'm not that close, Kris.
No, you're good. You're good. No, no, but happy to help, you know, for sure. So if you know, right now our Port Charlotte location is the one that is open. Sarasota is under construction. So, but yeah, anyone here on the team would be happy to show you around for sure.
Thank you.
Kris, I have one more question. Sorry. You mentioned the health assessment form, and Yeah, the process for them to sign all the paperwork, they'll get the test. It's insane, like you mentioned. So do you know if the health assessment form can be filled out or completed by another medical office besides their primary care doctor, or
Yes.
it
Yep.
has to
Anyone.
be
It can be
anywhere? So they can just go to any clinic. I need this, I need this test.
Yep.
Okay.
They can walk. They
perfect.
can walk into a Minute Clinic. I know, like right now, we have a company that's like a mile down the street from us called Company Care, and that company like they do TB tests in house. It's $20, and they'll
Mhm.
take care of it. So we'll recommend them to go there. We'll recommend them to go to a Minute Clinic, to get the
Mhm.
TB test done. A
Yeah.
lot of times we will help facilitate the paperwork. So when people have the health assessment form, we find out who the doctor is. We'll they'll go ahead and we'll encourage them to do it as well, but then we'll send that form over to the doctor too, and like between all of us, like we're bound to get it back. Plus we
Right.
simplified the form down to like 2 pages, so it's a front and a back, super simple,
Yes.
nothing complex, like we're trying to streamline the entire process.
Right, right. Yeah, we're trying to do that too. We're trying to partner with a close by clinic, and we already gave them our form, but we just wanted to make sure that we could do that, or they had to go to their primary care doctor to get that done. So perfect. That's great.
Yeah, if
Thank you.
it's someone else, they just need to have a visual on that person, and
Right.
to be able to get that, and then be able to get maybe the medical history, but a lot of times the family can provide that.
Okay. All right. All right. Perfect. Thank
All
you.
right. No problem. I think we got some other ones. Who else we got on here? I have some more questions in the chat. Feel free to just jump into the conversation here.
Can you hear me, Kris?
Yes. Hi.
So I put in the comments, can I talk? Or I don't know how, I've
Yeah,
never been
yeah.
on one of these
Yeah.
before. So does your company, because I heard you say you do a franchise. So I'm in Iowa, and I don't know if anybody's seen the statistics in Iowa of like how many of our RELs and houses we've lost because of the administration and that. So for the last 2 years, I wanted to do adult group homes for our elderly because I'm in Iowa and there's not enough. And, I had to go I'll give you the short version, my in-laws. So I have a 9,000 square foot building. I'm renting to own it. But what I'm running into is I'm attempting not to fight with the state, but it's $30,000 to $40,000 to put a sprinkler system in to become an assisted living. So I don't know if there's anybody. I have 6 people right now. I charge $1,700 to $2,200. I do 3 meals a day, but I have everybody's medicine bubble wrapped because I didn't know going into this. The state of Michigan is different, but the state of Iowa, anything over 3 people, not related, you have to be a boarding home. So now I'm the boarding home, and been at this for 2 years. I cash flow not as much as I'd like because obviously I can't charge the ALF or our, those prices. But so that's what I was curious of you guys franchise to do that kind of thing.
Gotcha. So we're, because so are you thinking about putting an adult day center in there, or are you thinking about like continuing
It's
the RAL?
doable. It's doable. I just know, like the other lady that's talking, I'm one person, so I'm actually doing it all. And then my part is like I have a kind of a home health care business, like third party. That's with the medication management. Everything's bubble wrap, so we just do medicine reminders. So
Yeah.
I would like to have an adult daycare in there, and the building's big enough. It's 9,000 square feet.
Yeah.
But I just don't know this part of the business is where I'm at. So that's why I'm interested in what you guys
Gotcha.
do.
Gotcha. Yeah. I mean, yeah. So I was just trying to clarify on the assisted living versus like the adult day side, like what direction you were, thinking of going. I would say like, like I like with the sprinkler system, depending, that might apply to the adult day as well.
Okay.
Like I know, like
Yep.
I know our building we're building right now, like because of the size of it, like we have to have a sprinkler system in it. We try to get around it with just a fire alarm system, but they didn't allow it in this particular county.
Okay. Yep.
So so it's one of those things that like, it's like hit or miss whether or not that'll go through. But I know so typically what happens is like, an assisted living facility, you'll have less square footage you'll have like you'll have more square footage per person that's there, where in an adult day we might have way more people you know, in a smaller footprint, you know, like in 9,000 square feet, you know, depending on how you like subdivided it up, it could probably like hold somewhere between like maybe 15 and 20 to 25 people if there was like a room or
I
shared
can
rooms or whatever, you
technically,
know.
yeah, I could take up to 16 people. Like my house
16,
has
yeah.
16 to actually 18 rooms and the whole third level. Yeah, so it's actually a very nice setup in all honesty.
Right. So I mean, like it'd be like, so my thing is like, you know, you might have to have the sprinkler system because of the overnight component to an
Okay.
ALF. You know, like, but then if you have
Yep.
like the daycare component, it like they might rule over the sprinkler system where it's like, well, because instead of having 16 people, you might like get licensed for 20 or 30 people under that environment to like to compensate for the same amount of like, income,
Okay.
you know, for the square footage. And then they might have to rule like, okay, well, you need a sprinkler system because you have over 15 people, now it's an assembly building, you know.
Yep.
So it's like, so I think it's gonna be hard to get around that ruling, you know.
Okay.
Is it in a residential setting or is it a like is it a
It
residential neighborhood or a residential home?
it's
Is it, or
actually
is
in
it
it's 20 minutes outside like the Quad Cities,
okay?
and it's in town. So it's actually in
Okay.
town where we're at. So there's a lot of farmers and it's a big need. And I think we're bordering on losing funding for like the adult daycare that we have 20 minutes from where we're at, just because
Yeah.
Scott County doesn't want to fund it. So I just know it's a need, and I just know all of this is a need for our elderly population. So
No, for sure. It definitely is, you know. I think if like if the way you're describing it being set up, I would to me, I would think that the best thing for you to do would be try to like, how can I like bite the bullet to do fire sprinkler systems and then continue on the assisted living path,
okay.
you know? And
Yeah,
then,
I'm just like,
you
I
know,
think if I could find investors, or like we lease the building. So I know the building
yeah,
could be sold to like an investor wanted to come in and franchise and put an adult daycare center. It'd be the perfect, and I'd work for somebody. I just don't have
yeah.
deep enough
Well,
pockets. I mean, I
right,
can
right.
cash
Well,
flow at 12 grand, a month, but
yeah.
I don't know, like if there's
Well,
some way around
we
that
could,
part of it.
yeah. I mean, I think we could always like dive a little bit deeper, maybe on
Okay.
a franchise call if you wanted to.
Okay.
Like, we
Perfect.
could certainly schedule something like that later, you know,
Yep.
and dive deeper
Perfect.
on your specific situation.
Thank
And
you for
then
your
I
time.
see, yeah, no problem. Nice to meet you. I see Mary. Good old Mary's back. Mary's got her hand up. Are you there, Mary?
I am. Can you hear me now,
All
Kris?
right. I got you. Yep. How are
Hello.
you?
Apologies for getting on late, but I wanted
That's
to
okay.
get on. I missed you
Welcome.
last month. But I just wanted to say to the person from Iowa who is facing the expense of the sprinkler system, here in South Carolina, I was required to do one also. And the building is 4,000 square feet. And that sprinkler system cost over $40,000. And I was floored. But that's not the worst of it. Now, after having it installed, and this big, I have 2 meters now, and the big meter for the sprinkler system is outside in the ground, never used, but the water company charges me $180 per month for that meter.
Wow.
No usage, no usage. I was just in
Wow.
to sit and talk with them again last week about it. So I have 2 meters. The basic price for one is $58, and the base for the big unit for the sprinkler system is $180 per month.
Mary, are you having fun yet?
Not, I have not. Everybody's making money but me, Kris. But Kris,
Hey, we're gonna get you there, Mary. We're gonna get you there.
Next month, this time when I call in, I hope that I will have some clients. I have some potentials. Yep. We're getting there, but I just
You're not alone, Mary. You're not alone on that boat.
Yes, yes. But we're gonna get there. It's been a journey. But best wishes to all of you. And thanks again, Kris, for all that you do for us.
Is there any specific questions you have, Mary? Or?
No, I just wanted to comment. Okay. You've answered all of my questions over the months, over the years.
Okay.
Thanks so much.
Well, hang in there,
Mary.
girl.
Yes, sir.
You're gonna get through the finish line. I can see it.
That's right. Thank you.
You're almost there. All right, girl.
Thank you.
Good talking to you. I think I saw one more. I always pronounce your name wrong. Mayo. Let's see here about
Yes,
the.
my
Are you still on?
Mayua. Yeah. Yes.
Mayua.
Yes. Good to
All
see
right.
you.
Good to see you.
Yeah.
How are you?
Good. Good.
So to answer your, where are you located again?
Wisconsin.
Wisconsin. Okay. So, by any chance, does the state of Wisconsin have a standard form that you found, or like, do you know anything about as far as the licensing side and them having a standard health assessment form?
They don't have one. They just in the DHS code.
Mhm.
It just says to have a assessment form.
Okay.
Asking about health, the history, the person's condition and what would the person like to do. That's
Yep.
it. So I will have to like go and Google it or find a way
Yeah.
of,
Yeah. So I know ours on the front side, it is literally like, it's just like, demographic information at the top, and then it's like, medical history, known allergies, just anything related to like ambulatory, needs, and so like, it's very like simple. And then on the back, it's like a little, chart of like, they can put in the medications, and any of the specifics about their medications, and then a signature. And it's like, it's as simple as we possibly could keep it,
Okay. Do you know where I can buy these forms or like Google?
I would
find
just
it?
Google health assessment form,
Okay.
and then just pull off of it like just the bare minimum that you would need, for you to, for it to be like, for it to be like something that your state, like, because sometimes the state will have certain things within the assessment form that they may want it to have, and they may list like, hey, like the assessment form needs to have this, and this, and it's got to be signed by maybe a nurse practitioner or an RN or a physician, or like it might be specific as to who it can be signed by, and then like, when you would need it by, and then what things it might need in it. So sometimes the states will list those things, and then it's like up to you to come up with that. So you could at least like, if the state's not specific on the actual things that need to be in the form or who needs to be fill it out, you can certainly go online and get a general form. We just made ours on a simple Word doc, but.
Okay. Okay. Yes. And my other question that I posted here is, do you or any one of you found that it's hard to like, like I heard the other ladies here talk about they want a, sprinkler, it costs 40,000. They had, you had to fight with the state through all these process. But then once we get certified, I found myself lost. Like, I don't know, like, how do I get billing? Like, how do I get reimbursement? Now I had to go and find contract. The rate is not, like you said, with Medicaid, a lot of my client would be Medicaid. It's half of private pay, it doesn't cover a lot of costs, and all these sorts of stuff. How do you all survive and how do you all do it?
Yeah, so I think like honestly, that's a big reason for why, I know we're trying to have these calls and provide this information, because I think the number one problem I've found is that, people have this great idea and they want to move forward with it, and then they go through this process, and then, like most people have no idea what the process looks like. Most people, don't realize the regulatory side of it, and then they go through the zoning department, and then they go through licensing, and then they go through all this stuff, and they're just like, oh, like, and you're learning along the way, and you had no one to guide you, and it's like it can be nerve-wracking because you could be halfway into it, and you're like you've spent some of your life savings, you're like really deep into this project, and you're like, I can't turn back now, like it's too late, and you're like, I got to continue forward. But then again, like you're like, I didn't realize we were going to face all of these things, and I think like, that's like the dilemma that I see so often, that my hope is we can try to solve that through having these webinars and having these discussions and putting out the content on YouTube. I would say that like, so remind me of the state again.
Wisconsin.
Wisconsin. Okay. So Wisconsin, do you have anyone near you that you've built a relationship with at all? that
I'm
has
just,
an adult day center?
I'm very new, so I've been contacting others. I don't like. There's one in town here. Like
Are you guys, so are you officially licensed and open now?
yes.
Okay. Let's see here. I was just trying to, so it looks like, yep, okay, so it looks like there's the Wisconsin Adult Day Services Association. Are you familiar with them at all?
The Wisconsin is the coalition, Wisconsin Association.
It's wadsa.org.
Yeah, I've emailed them and never got a response back.
Okay.
Yeah.
I would keep cold calling any of the organizations. I just keep calling, like make it you spend an hour a day calling. That's kind of what I had to do a wait list just to interact with people. And then you're out there and they know who you are and they can connect you with, someone that does what you do too.
Okay.
I was gonna say that, the best thing, if you're able to look up if you can identify an adult day center in your area, or even like outside of your local market, and just find one that is very similar to what you similar to the market in which that you're going to be offering or catering to, like maybe similar demographics, maybe similar size. There's going to be some owners that are going to be turned off and not want to provide any information, and then there's going to be some that are going to be willing to certainly help, or to at least maybe sit down and have a conversation with you. I think, because of the fact that every state, the Medicaid program is so different, the best thing for you to do would be to have a conversation with someone in your state who's actively running an adult day center, who is very familiar with the Medicaid billing process. Because the hardest part is if we go across state lines and we're focused, more on the private pay side, it's different because our private pay consumer is the same. But when you have the Medicaid side of things, every state we go into and we accept Medicaid, it's going to be a very different process, and it's going to be very it's no two states are going to be identical, and I think that's why building the relationship with other owners in that market, that could maybe guide you or kind of show you hey, contact this person or go here or talk to this person. That's going to be the best thing. I know in the state of Florida, we are a managed care state, meaning there's an insurance company that receives the funding from the state through Medicaid and then distributes that funding, here to the actual individuals and kind of manages that care. I don't know if that's the same way in Wisconsin with the MCOs like that, but I know, we would get our Medicaid license, then we would have to go get partnerships with individual insurance companies, and then you'd have to work with the case managers, build relationships with those case managers who are going to be authorizing those services in the adult day center. And it's those relationships you build with those case managers that are going to start driving the referrals to your business, and so if you're in this area that where your focus really is primarily on the Medicaid population, then it's going to be really how do I develop the relationships with them? What can I do? Can I bring them in for a tour? Can I start can I do an event where we can bring all the case managers in from these MCOs? But I need to start building relationships and meeting those case managers and introducing them to our services and what we do and how we're unique. And because if they don't know about you, there's no way for them to be able to start sending you referrals. And then the private pay side is a little bit different because it's a little bit more broad. But if you're more Medicaid focused, you can really target those MCO case managers, or you can go out and educate the public that that you have these adult day services for free, for those that are on Medicaid, and you would just have to provide them with the appropriate route to get qualified for services or to get authorization for those services.
Okay, that's a good idea. I think because I have a niche of my community, so that they know the service already. But I think I like the idea that you said about building that relationship with the case workers, the case managers, and do an event for them to come out to my facility and maybe learn about our culture. and you know, what our people are like, what our cultures are, what do our people need, you know, especially their members, you know.
Yeah,
So
for
that's a
sure.
very, yeah, thank you for sharing that.
Yeah, I know my friend, he like is about 95% Medicaid, you know, and I know like they had an event for case managers and they had about 40 people in attendance at that event. And it was like just a night to just spoil case managers and social workers that worked for the MCOs. You know, I know like we did an event for case managers, but we were more focused on like the hospital case managers and the skilled nursing rehab case managers, because those are the ones that are kind of like helping direct families, you know, for like different private pay services. But what's nice is like with the MCOs, like you know that like the target audience is the MCO, because the MCO has to write the order, you know. They have to
Yeah.
give the approval for those services.
Well, last question. How much is usually like a rate, like a good rate, or like in your area, does MCO?
Yeah, so in our area, MCOs probably reimburse anywhere between 50 to like $80 a day.
Okay.
And then, you know, and then the thing is like we like, you know, it's different. Like I know Suzette is in Miami. Miami's a highly like Medicaid focused area. So like the problem with that sometimes is that the MCOs have the leverage because they have more options. So that like it's harder probably for Suzette to like demand a certain rate because her competition down the road like maybe willing to take a lower rate, you know. So depending on your area and how dense it is with the number of people or the number of adult day centers in your market, you might be able to like ask for a higher rate or negotiate the rate, you know. So I know with us, like we were able to negotiate our rates. But I don't want to say that everyone can do that. We just are fortunate because we don't have a lot of competition in our area. And so we were able to do that. And so but you know, if you're, so it depends a lot on your area, but if you can, you know, just because they say here's your rate, it doesn't mean you have to accept that. A lot of times there's some negotiation room, you know.
Okay. Yes.
And
then, yeah. And Kris, I wanted to thank you. I really appreciate, you know, your time and hosting this and sharing, and, you know, also helping all of us, you know, going.
We all need it. Like, trust me, like I you know, there's 35,000 home care agencies, you know, in the US. There's 28,000 assisted living facilities. There's 15,000 nursing homes, but there's only 3,500 adult day centers. And like, we need to build a community of like really strong operators, you know, that like, you know, can grow and actually like build successful adult day centers. If adult day is going to have a larger presence, like we need more adult day centers that are successful, because that success that those adult day centers experience will generate more awareness and more positive awareness that this is a good solution for families. And over time, that'll be what helps the adult day industry grow. But right now, it's such a small industry that it needs every bit of like just, you know, assistance it can get to help all of us on this call, anyone else that's thinking about starting an adult day center, anyone else that's currently operating one that is like, you know, that is struggling, like we all got to band together and, you know, learn from one another and become, you know, better at running the adult day business, because we all have big hearts, we all care a lot, and that is obviously really important. But we all have to become, you know, better at business, marketing, operations, leadership, and all of those things to make the business successful, you know.
Yes, thank you.
So, all right, guys. Hey, I really appreciate all you guys' time. It was a pleasure meeting everyone and seeing everyone on this call. You know, thank you for joining. You know, we will be here together again in July. I believe it's the second Wednesday of every month. So we'll see you sometime in July. We'll send out emails and notifications, all good stuff. Have a great week. Have a great month, and we'll see y'all soon. Thanks so much, guys.
Hey guys, thank you so much for joining me. If you'd like to learn how to open your own adult daycare center, go to adcpro.com. If you'd like the latest business tips, click here, and make sure you subscribe to our channel. Click here. We'll see you guys next time.